So I get asked the question all the time, are veneers permanent? And the idea of what we're doing with veneers is putting them on the teeth so that they are actually bonded on and created as one structure between a tooth structure and a veneer. And so when we're looking at it from a big picture, we want it to functionally work as one unit. And that way, it's going to last a nice long time. So they are two separate pieces, your natural tooth with the thin veneer, but it's bonded and chemically structured to be able to handle as one. We don't want veneers to be popping off. That is one fear that a lot of patients have. Do veneers pop off? The idea is that if functionally the teeth are put in a good spot, those veneers should not be popping off, that they should last 15 to 20 years and be able to aesthetically hold the look that we're going for. People always wonder, how long can veneers last? And the reality is, it really depends on where we are starting from. If we have natural teeth structure that have not been touched and are virgin teeth, then we're able to get a lot longer lasting time period for our veneers because we're working with a healthier foundation. When we have teeth that have been done or root canals or implants, then we're working on a foundation that may not have as much strength and may not last as long. When we can get the teeth in a functional position that is healthy for each patient, then those veneers should last 20 plus years. We see it all the time where I'm redoing veneers that have been there for 20 years. One, because the aesthetics of the porcelain has gotten a lot better, where we can create more natural, beautiful veneers with our harmony veneers that we have created. If we get those veneers in a good functional position, then those veneers should last 20 plus years. The factors that affect the longevity of the veneers is one, where we design the veneers and functionally where they're placed. When we look at a bite as a whole, we want each tooth structure to function in a certain way. And if we do that in the correct idea, then the forces that we're putting on each tooth is going to allow for those veneers to last 20 to 30 years. We want to make sure that the teeth are minimal prepped because the foundation of those teeth are natural teeth. And the more tooth structure we have, the better and the stronger that those veneers can be in the long run. So what we want to think about is, one, what do those veneers look like, and aesthetically, how are they going to look good? But also functionally, where are we putting them in a bite standpoint? And how are we putting them so that they're working together as a group to function correctly and create the less amount of stress? So once you get your veneers, you should really come and see your dentist every 3 to 6 months. Just like your natural teeth, you want to come in for consistent cleanings. What we also want to do is be able to manage and watch the veneers and make sure that if anything is going on, that we're catching it early on. If you're coming in for a cleaning, we want to make sure that we're cleaning that buildup and allowing for a clean surface, and that the gums are being healthy and that we're not seeing any recession. So when it comes down to it, we want to make sure that we're seeing you every 3 to 6 months once you've gotten your veneers. So the improvement in veneers have come a long way over the years. We look at the materials that we're using now versus what was used in the past, and it's a major difference. Right now, what we're able to do is we have materials such as Emax, Lysipress, Amber Press, and these materials are looking more natural than ever before. We've got materials that are stronger and able to hold more forces than the teeth that we were doing 20 to 30 years ago. So now that we've got better materials for function, but also better materials for aesthetics, what that's done is allow us to create a product that is going to last longer, but also look prettier. Within my design, I look at each individual and I decide on what material is going to be best for them. Everyone is unique and different, and so it's not one size fits all. It's about that individual and unique ability, and how do we create that smile for them. We have 3D printing. We have scanners now that are getting better and more accurate results. We've got better bonding material so that the teeth are stronger and we don't have to prep the teeth as more. We can now do minimal and no prep veneers that are looking very natural and don't have to look fake or that Hollywood bright white smile. And so it's amazing what we can do with newer materials but also what we can do with the right design for each individual to give them that unique smile that's right for them. So I created this company called Hales Aesthetic that is solely focused on cosmetic dentistry. And I found out that there was always limitations early in my career when it came to cosmetic dentistry and what we were producing. And I wanted to create a different way that was best for the patients to be able to get an outcome that was more natural and also focused on function. The idea is to give people smiles that are unique, but really flows with what they had either in their younger years or giving them a more youthful smile. And the way that we've been able to do that is through my master ceramist, Daniel Yang, coming together and us studying and understanding the function and the aesthetics of natural teeth. And then how do we implement that within porcelain? What we've created is what we call harmony veneers. And this is one of the top veneers out there on the market. Right now, me and Daniel are the only ones producing this. And we're able to see amazing results that people are able to smile again and have confidence in their smile. We take every aspect of our process and we've uniquely designed it for each individual so that they can get the outcome that they want with the great understanding of what they're getting before they get the final results. So with it, you get a team that is focused on your overall health, but also on your goals of achieving that aesthetic smile that you've always deserved.